Welcome to the latest OncoShorts podcast, brought to you by MedSynapse. OncoShorts is a weekly program covering a wide range of clinical and scientific medical content that offers enriching insights into the world of oncology. Listen to our today's podcast episode, which focuses on the recent FDA approval to Tisotumab Vedotin-Tftv for recurrent or metastatic cervical cancer. Cervical cancer is the most common type of cancer in women aged up to 65 years and a reason for high mortality worldwide. According to the statistics, cervical cancer has a global annual rate of 275,000 deaths. The primary cause of cervical cancer is the human papillomavirus, HPV, contributing to about 99% of the cases. Progress in the management of cervical cancer has improved in recent times, but the prognosis for women with metastatic or recurrent cervical cancer is still poor.
Tisotumab Vedotin-Tftv, a tissue factor-directed antibody and a microtubule inhibitor conjugate.
It is the first and only approved antibody-drug conjugate for adult patients with recurrent or metastatic cervical cancer with disease progression on or after chemotherapy. The accelerated approval of Tisotumab Vedotin-Tftv was based on the findings of the Phase 2 INNOVA-TV204 clinical trial, NCT03438396. The updated data was published in The Lancet and previously presented in the European Society of Medical Oncology, Virtual Congress 2020. INNOVA-TV204 clinical trial was an open-label, multicenter, and single-arm study which evaluated 101 patients with recurrent or metastatic cervical cancer. These patients had received no more than 2 prior systemic regimens in the recurrent or metastatic setting, including at least 1 prior platinum-based chemotherapy regimen. 69% of participants had received bevacizumab as part of prior systemic therapy. Patients received Tisotumab Vedotin-Tftv at 2 mg per kilogram every 3 weeks, until disease progression or unacceptable toxicity. The main effectiveness outcome measures were confirmed objective response rate, as determined by an independent review committee using RECIST version 1.1, and duration of response. The objective response rate was 24%, which included 7% of patients experiencing a complete response, while 17% experienced a partial response to the antibody-drug conjugate. The median duration of response with Tisotumab Vedotin-Tftv was 8.3 months. After at least 1 post-baseline scan, target lesions were reduced in 79% of patients. After a median follow-up of 10 months, researchers discovered that 49% of patients had stable disease and 24% had progressive disease. Tisotumab Vedotin-Tftv also showed a tolerable and manageable safety profile, with common treatment-related adverse effects. Alopecia was the most common adverse event, with a higher incidence rate of 38%. Other adverse effects observed in the patients included epistaxis, nausea, conjunctivitis, fatigue, dry eye, myalgia, anemia, asthenia, arthralgia, decreased appetite, keratitis, and pruritus. In this study, 4 patients died, out of which 1 died due to septic shock that was treatment-related. The recommended dose of Tisotumab Vedotin-Tftv is 2 mg per kilogram. It is given as an intravenous infusion, over 30 minutes every 3 weeks, until disease progression or unacceptable toxicity. Based on the study results, it can be concluded that Tisotumab Vedotin-Tftv is clinically effective and has durable anti-cancer activity. Additionally, it also demonstrated a tolerable safety profile in patients with recurrent or metastatic cervical cancer. Considering the poor prognosis among the patient population and the low efficacy of multiple therapies, its approval represents new dynamics to the treatment strategies. This concludes our today's OncoShorts podcast, brought to you by MedSynapse. Thank you for listening.